My new book is now available. It's called Peace Over Pain: How to Eliminate Chronic Pain and or Chronic Illness so you can break free from the medical monopoly. If you want it instantly, you can get the ebook and audiobook together as a package on peaceoverpain.com. And of course, the paperback is available on Amazon right now.
Welcome to Inner Peace with Dr. Reese, a program that can help you become liberated in the modern world. Now, here's your host, Dr. Kevin W. Reese.
What's it like to watch death slowly? Welcome to episode number 139. Today, I'm bringing back Keysha Rowe. She's a veteran hospice nurse. I wanted to bring her back so we can explore and get really close to death. She's gotten permission to share some incredible stories and experiences that she's been involved with in this line of work. I feel this is a very important episode. So sit down, relax, and take in this beautiful and valuable recording. Let's begin. Keysha, welcome back to the podcast.
Hi, how are you?
So yesterday, I texted you and you were like, hold on a second, I got to do a pronouncement.
Mm-hmm.
And it's like, that's something you don't hear from another human being very often. And of course, you're referring to you had to call the death
Yes,
of another human being because you're working in hospice, right?
correct.
So what was that like yesterday?
Just had to give a lot of support to the family. It wasn't my patient that I had to pronounce, actually. It was someone else's patient that I had to pronounce, but I was just in the area close by, so I was able to do it.
Mm.
It makes it hard when you don't know the family, but you still can give the same empathy and the same kind of support and comfort for the family. But they did require a lot of support. This family actually had a really hard time coming to terms with their family passing away. So
Why? Because in my mind, I'm like, death happens.
mm-hmm.
You've certainly seen enough of it.
Yes.
But what do you mean that they have trouble coming to terms? Are they in denial?
They're in denial. You have a lot of patient family members that don't, even though the patient themselves have already accepted their prognosis or accepted that they're going to die. A lot of the family members do not accept that the death is coming, the death is near, or even the death even happened, which is what transpired yesterday. Some family members were just like, no, check the pulse again or check this again.
Wow.
They didn't even want me to even take the oxygen off either. So
Oh, wow.
mm-hmm. It takes a lot of hand holding,
Okay.
and talking to them and everything, and kind of like just explaining to them that they're no longer suffering. I know that we selfishly want them to stay here, and we want them to be here, for us and be here with us, however, this was their time, and we have no control over this. There's no playbook in this. There's no playbook on how people are going to react, or there's no playbook on how people are going to cope with their loved one dying either. It's just kind of like you just you actually just meet people where they are in their grieving process. So
Sounds very dramatic.
it can be at times.
And you have to do this all the time.
Yes, I have to do it all the time. Sometimes, you have families that are accepting of it, I think sometimes it helps more when the patient has accepted, when the patient is alert and oriented and has accepted of it. But I have patients that aren't alert and oriented, like my patients that have dementia, they're not alert and oriented, so the family is making all the decisions, not them making the decisions for them. And so it's it makes it difficult sometimes when the family has not accepted the death and dying process thing. So
for those that may recognize your voice, you were on the first 12 episodes of this podcast.
Yes.
Just over 2 years ago now.
Right.
And, you were engaging along with Tina in conversations with me. And so here we are again. And I remember one of those conversations that we had, you told me or the audience about a situation where this woman died so peacefully, and she she was totally in acceptance of it.
Yes.
And it was like this beautiful process.
It was, I had never seen anything like it before. She was my patient. This was prior to the company that I work for now. She was so accepting of it. It was so beautiful. She did a lot of yoga and meditation in her time before. And the daughters were saying she doesn't want to be medicated. She wants to feel it all. She wants to feel it.
Yeah.
And, and at that time, when I was a hospice nurse, then in my head, I couldn't understand that. I couldn't wrap my head around it. I'm like, why doesn't she want the morphine? Why doesn't she want the Advil? Why does she want this? That's the things that we use to keep our patients comfortable when they are actively dying or transitioning, as we call it, transitioning. And I had never seen anyone pass away that way, so peacefully, no meds, just all she kept doing was breathing through the entire time, just taking all these deep breaths. And I didn't interrupt her. I just sat beside her and just sat there with her. Didn't speak to her, because she actually told her family, don't talk to her when she's going through this process, because she asked them to say everything that they needed to say to her before she goes under, I guess, in her transition. And that morning, she was just breathing very peacefully, very deep breathing, like a lot of deep breathing. And it was then all of a sudden, you could see the breaths getting slower and slower. And then she was gone. No, and I didn't see any, in a lot of cases that I see, you see a lot of people having elevated respirations, pulses elevated.
What, because of anxiety?
Yeah, anxiety. Yeah, and because of, sometimes it could be also because of pain as well. Whether she had pain or not, the type of condition she was in, she should have had pain, but she didn't show it. Everything was, her vitals were normal. They were normal. The only thing I took was a heart rate and her respirations, and that was it. And her heart rate, throughout the process, you'll see it, slowing down a little bit, but just in her breathing was slowing too, but never did she show any signs of distress.
That's awesome.
Mm-hmm.
Yeah, that's a role model.
Yeah, definitely. If I'm gonna die, that's how I want. That's how I want to die.
And that's why it's so important to practice meditation. That's how I rationalized getting into meditation in the first place.
Okay.
13, 14 years ago, maybe even. Like, I remember rationalizing it as, this would be a great skill to have when my time comes.
Mm-hmm. Yeah.
And here I am all these years later, doing all this practice and doing this podcast. And I can definitely say that my little download was correct.
Mm-hmm. Mm-hmm.
If we don't practice how to die, which is meditation, then we're either going to go very painfully or very scared.
Yes. Yes. And you do
And
have people that they are afraid, or they say that they're not afraid, but you do sense the anxiety. But most of the time, it's not that they're afraid of dying. They're afraid of the people that they're leaving behind. They're afraid for them.
right.
They have anxiety about what's going to happen to the people when I pass. And which is why I always talk to the families and tell them, you know, when I have a good rapport with them, I say to them, you know, let him or her know that it's okay, that you're going to be okay. It doesn't mean that you don't have to mean it, you know, because we know that, you know, you're going to go through these ups and downs, but I have to also talk to the family, say to them, but you are going to be okay. Like I have to, they be like, I'm not going to be okay though. I can't tell her if I'm not. And I'm like, yes, you can, because you are going to be okay eventually. You will be okay.
Sure.
Yeah.
Everywhere we look, especially in the social media era, there's death.
Mm-hmm.
This person's mother died. This person's aunt died. This person's
Right.
uncle died. And it just, if you scroll through your Instagram or Facebook enough, you're going to run into it almost every day.
Every day.
It's a topic I talk about in my new book, where if life is a school, death is your final exam.
Yeah. Mm-hmm.
And you don't want to fail.
Right.
Because if you're passing, okay, the word passing comes from your spirit or soul leaving your body. It's a passing, right?
Mm-hmm.
So you don't want to, quote unquote, pass in fear
Right.
and anxiety.
Mm-hmm.
You want to pass away in joyfulness and peacefulness,
Right.
just like this woman that you talked about a few minutes ago.
Mm-hmm.
That's what we want. That's the final exam.
Yeah. I know that I wasn't there for my dad's passing. My sister actually was. And her reaction to it was she cried, but it was like a cry of joy for her, because she kept saying, you should have seen it. It was so beautiful. That's all she kept saying. It was so beautiful.
Wow.
Because she said, you kind of, the person that sees it happening, it kind of like, and I think you have to be connected to it in order for you to like really see it and understand. There's some kind of light that happens.
Yes.
It's like their face, their eyes, everything just gets bright. Like it's like a light. It's like almost like an aura, I guess, you see around this person. And I know when it's happening. Like I know when the passing is happening, because I can see that light. I can see that and it's not a literal light, but it's just like, you know, I can't explain it, but it's just, I know it's happening. And because it happened with my grandmother. I was there for my grandmother's passing, and I said it. I called everyone into the room. I said, everybody, she's passing. She's transitioning over. Everybody came running into the room, you know, and I could see it. And then even like my family was like, how did you know? How did you know what was happening? I said, I can't explain it. I just know. You just see this. It's just this light you see. And everyone has it. Everyone, it happens to everyone.
Yeah.
Every passing that I've seen, that I've always seen, that I've always witnessed, and I was there for it, I always see that light, and I always know that it's happening.
Right. Do you feel like being around so much death actually positively affects your life? Or
when I first became a hospice nurse, no. It didn't. It was like very depressing, but I was just doing it because at the time it was a nursing job. I was going to do it, you know. But then I started really getting into it, and but every time I leave hospice, I always come back. I always go back to it, because it's not anything that I chose. Hospice chose me. I didn't choose hospice. So now because I'm in it now, I'm not afraid of death.
Right.
And that's the first time I've ever like said that out loud.
Nice.
I'm not afraid. I'm not afraid of dying. You know, my only things is just worries about my family and me leaving. The same as
Right.
like you know, as everyone else. But as far as dying, I'm not afraid to die.
We're born to die.
Yeah. It's not like I'm gonna be going out there doing stuff reckless because I'm like, oh yeah, I'm free. I'm not afraid of death. You know, it's not that. It's just more like, you know, it's my time. It's my time. And I'm smiling about it. I'm smiling about it because it's like, it's almost like like, again, I'm worried about my family and I'm worried about, you know, how people are going to be, but it's almost like you like, I can't wait to die, but in
Yeah.
a smiling way, you
Yeah.
know, not, and and people may look at it like, oh, she's depressed. No, it's not that. It's just getting to that side, that
Yeah.
other side so that I can live.
All right. Yeah. Just a few weeks ago, I was holding a newborn in my arms.
Oh.
Buddy of mine had a baby,
Mm-hmm.
and I'm holding the child. It's got to be like 3 weeks old, you know, small, head bobbling all over the place. And I'm just
Were
looking.
you properly supporting the head?
Yes. And I'm looking at this little baby and I'm like, you're going to have to die.
Mm.
Like, this little child is going to die.
Mm-hmm.
You know, hopefully not to her 80s or 90s, but you know, it's
Yeah.
like the journey has begun
Yep.
and it's going to end.
Mm-hmm.
And it's the only guarantee.
Yep.
And
It is.
there's something to be said about that, you know.
Mm-hmm.
And so I'm reminded of the story of Socrates, who, you know, he was convicted by the government and sentenced to death.
Mm-hmm.
You know, similar situation as Jesus.
Yeah.
But they did poison.
Mm-hmm.
And the night before, his disciples all got together and they figured out a way how to break him out of the jail. And he declined.
Mm.
He said, I'm good. I'm ready to
Right.
die.
Mm-hmm.
And the next day, they injected the poison. And, you know, it's a slow process. And he was like very mindful.
Mm-hmm.
And he was observing his feet and his legs and then his torso. And, then, you know, like he was like, oh, this is like he had a curiosity about it.
Mm-hmm.
He was ready.
Yeah.
And I feel like if we all take that approach, just like the woman you talked about,
Mm-hmm.
this can be a really beautiful thing.
Yeah. Yeah. And I think part of it too, it's cultural with some patients and families that I have. Definitely culture plays a huge part in the death and dying process and accepting them going through all the different stages of grief with bargaining and denial and sadness and acceptance. I mean, they go back and forth. No one really stays in the grieving process, you know. No one grieves at the same time. And sometimes you go through several stages of grief at different times. You could be accepting and then go back down to like grieving again, you know.
Right.
So it's like it's kind of you know, it's cultural. I definitely see that it's cultural or what their upbringing was in accepting the death and dying process and, you know, and the steps and everything. But, you know, I feel like I'm like the person here for them to show them that whatever feelings that they're having, as far as the family goes, whatever feelings that they're having, is all normal. The feelings that they're having are normal.
Yeah.
I know there are not going to be people around that are going to be like, oh, you know, they're going to always accept it. You know, you're not going to always have those people. And, you know, those can be difficult cases, but, you know, I find myself that I'm able to work through them with the families. And eventually they get there, you know, and sometimes I don't see the case through. I have, you know, if sometimes I'm unable to see the case all the way follow through because I'm not the primary case manager on some of the cases. But later on, I find out, oh, you know, they're starting their bereavement classes. They're going to, classes with, dealing with loss and everything. But, it's because they haven't accepted death, they know that the person is gone, but it's very hard for them to work through sometimes the grief.
Sure. There's a bond. A bond has been, yeah.
Mm-hmm.
So tell me a story that stands out.
What's so funny? The story that I'm about to tell you is the story that made me quit hospice the first time.
Right. This is your second stint.
Yeah. So, the call that I received was that he was having uncontrolled symptoms, and he was at home at the time. If he was at home, not in a facility. I don't worry so much about patients when they're in the facility because there's always someone there to take care of them, especially in the daytime, if certain things going on, you're able to get the APRN, but you're also able to get the on-call MD, at nighttime as well. However, when they're at home, it's not like that. It's the family who is taking care of their loved ones. So with that being said, I had this one patient, and military family, everybody was military. So I'm just trying to put that personality out there. Military family, they very strong. The patient was very stoic, just, but he was having uncontrolled symptoms. And I walked into the room, and you can hear the respiratory stuff going on. It was like all of the secretions, and it was just a lot of loud breathing in the room. And he had so much anxiety, and he was just like all over the place. Like, it was like as he could crawl out of his skin if he needed to. Okay. But it's as if he was reaching and grabbing because he couldn't take what was happening to his body at the time.
Was it a psychological response, or was it physical? It's psychological, right?
Psychological and physical response.
Okay.
Because when you you feel something physical, you get scared. So now it's in your mind. So now it makes the symptoms worse with what's happening to you because you can't control what is going on. And if you're someone, and the reason why I explained to you that he was in a military background, he's in the military, of military men, they're strong men, they can take anything. So so you think, but then in this situation, it was just like, he had no control, like none, about what was happening to him. And what was happening to him was that he was having a flash pulmonary edema.
Okay, he's filling up with water.
Yes. And so when anyone knows in the medical field, usually when they have this happening, it should be dealt with in the hospital, because it's a very uncomfortable, needing a bunch of medications to keep them, comfortable, like morphine and Ativan, just, a lot of stuff. So now we're at home dealing with all of this. The only thing you have is sublingual medication, trying to combat this. And no matter what I did, no matter how much I was hitting him with, it wasn't doing anything. So, but something in me told me, pick him up like as if he's a baby and cradle him in your arms. So he was laying on the bed. So I just kind of scooped him up and brought him close to my chest. And I kept rocking with him. And then he actually grabbed me around my waist. And as he did that, I could feel him dying in my arms.
Yeah.
I could feel, it was almost if I could feel his soul like move away.
Yes.
It like separated from his body. I can feel it separate from his body. It was like I could feel it pull through my hands, like, because I was holding him like this, but I could feel like this rush pulling through my hands and my arms. And he passed away in my arms.
Yeah.
With his family around the bed with me. His entire family was on the bed with me. And when he passed away, when he was gone, I laid him down back on the bed. And I told them, that he was gone. And the wife said to me, "How did you know that he was religious?" I said, "What?" She's like, "How do you know he was religious?" I said, "What do you mean?" She was like, "You were praying the entire time." I don't remember that. I don't remember the prayer. I don't remember anything. I don't remember what I said. All I remember is holding him and feeling that pull.
So here's how I'm interpreting it. It sounds like two instincts coming together, his and yours, because we all have this inner child, and it gets scared. And he was scared. And you holding him, it was equivalent to
his mom,
a mother holding a baby. And so, like a motherly instinct, and that's what it sounds like to me. And Osho says in his book, The Art of Living and Dying, that he says you're fortunate if you're in the room with somebody dying. And
well, that means I'm fortunate all the time, because
right. And this experience that you're talking about right now is one of those type of situations. He calmed down when you did that, right?
Yeah, he completely calmed down when I did that.
Right.
He held on to me. It wasn't like he didn't have like a tight grip on me. It was more like a relief that someone was holding him. But at that same moment, after I finished, and I put him back down in the bed, I said, I told the family my condolences and I'm sorry. And then I walked out of the room because I wanted them to have their time, but I needed my time.
I bet.
I walked out the room, walked outside, got in my car, called my boss, and I was like, "I'm quitting right now. I'm going to quit." Wow. I was like, "I don't want to do this anymore. I can't do this anymore." I was crying and stuff because I couldn't explain what happened to me, and I mean, I knew what happened to him. He died, but it was the experience I couldn't explain. And I think I thought about him for weeks, like after that. And I still think about him from time to time. I think about the moments that happened, but at least in those moments now, when I think about him, is not, "I'm going to quit." It was like, it's more like I'm relieved that I was there for him.
Yeah.
And I'm happy that I was the one that was there for him. Because I don't know because even one of the nurses that was, that I had discussed this with, she said, "I don't know if I could have done that." She was like, he needed you there that night.
Yeah. Yeah, that's heavy. That's beautiful. Can you share another one?
Yes.
There's many, I would imagine.
There's many stories. Patient in a facility, actively dying. Patient obvious signs of distress. And the daughter refusing to provide any type of comfort for her mom.
What is it? What do you mean?
Death and dying without meds. But this is me. I was taught meds. Give them meds. Start them every hour on meds. The mom was actively dying. She had secretions. She would only allow us to put the oxygen on, but she obviously was in a lot of distress. The daughter was just like so like stubborn. She did not want to give meds at all. And she just kept saying, nope, I'm not. But not only was she not giving meds, but she wasn't providing like the comfort for her mom. She wasn't sitting at her mom's bedside and holding her hand, or, you know, or trying to walk her through it, you know, or trying to talk her through it. She wasn't doing any of that. She just was like, just pacing back and forth, just watching her, just going through the dying process.
There was no tenderness.
Right. There was no tenderness and no empathy or no. And then when she passed, it was like, she almost celebrated it. But then I realized, to me at that point, I thought she was being heartless. You know, how are you celebrating your mom's death? Like, what are you doing? You know, that's how I felt. But she said, I'm not celebrating my mom's death. I'm celebrating her life. In my mind, I was so angry with her, you know, like I couldn't even hear it, you know, and I walked away from it. And then one of my nurse friends said to me, she said, you cannot be angry with the way she decided to do her plan. This is the plan she had in place for her mother. She wanted her mother to die naturally. And I said, but she didn't die peacefully. She was like, how do you know she didn't die peacefully? She said, were you there? Are you in? She said, you were there. She said, but you weren't in her body. So you don't know what was going on with her. You know, I mean, obviously respiratory symptoms when they're, you know, breathing heavy, it's not comfortable, but we're also taught that there's certain things that they're not even aware of when they're going through the transition. So who knows if they're even aware of their respirations elevating during this time.
Well, is it possible that the mother and daughter talked about it in advance? And
it could have been, but we will never know because that wasn't disclosed to us. So
when people,
but I just thought in my mind that here's this heartless daughter. Like,
right. when people die, is the lungs the last to go?
No, it's actually
a lot of people die from kidney failure.
Right. It's actually your hearing that goes last.
Oh, wow.
You can hear, which is why, to go back to my first story of my lady, she told him don't talk to her while she was transitioning, because she wanted to be focused. Because you can hear, your hearing is your last thing to go when you die. They can hear everything that's happening and what's going on.
But it sounds like the breathing is the
breathing is just a symptom that happens. Like if they're having any type of respiratory issues and things, it's just your body because your body goes into like a fight or flight mode, because the brain is the brain. The brain is doing what it's supposed to be doing. It's trying to compensate, because your brain is meant for it to keep you alive. Your brain is the one that works everything, you know, in your body. It's the one that controls. It's the central nervous system. It's the one that controls everything that's in your body to work.
So the woman you told me about, the first story, with her breathing and her meditation, she got her mind to calm down.
Yep. She told her brain, this is how we're going to work. You know, we're not going into that fight or flight mode. You're not gonna fight. This is what we're about to do. So.
And what a difference between her and the gentleman you had to hold.
Yep.
Now, what about someone dying from kidney failure? Is that typically a painful thing?
It can be painful. Most of the pain is not so much their kidneys per se. I mean, it can be, but it's more, it depends on why the failure is happening. Like some people will have, now if you're talking about someone who's on dialysis and because they're on kidney failure and they're on dialysis and they have to get their, you know, it's more like it's the edema that because they can't filter out any of the water because they're, out of their system. So it's the edema that causes them to swell up. Then they end up with high levels of ammonia that eventually gets into their brain, causing them confusion and everything. So, I mean, there's a lot of things that happens when someone's in kidney failure, as opposed to someone who's in kidney failure because there's an obstruction there, such as cancer or, some kind of blockage or something like that. It's the same thing happens to them as well, but the cancer is what at times caused them a lot of the pain. I've never known anyone with kidney failure who was on dialysis that say that they were in pain. It's more of, it's the edema, it's the swelling and the pneumonia levels that happens when they are confused and everything. So
is there medication that can neutralize that at all to make it more comfortable?
Keep them comfortable, yes. Usually they start them on morphine at 5 milligrams at every hour or 10 milligrams every hour, depending upon the symptoms. Because basically the medication is for symptom control. If they're having uncontrolled symptoms and they can't, I guess, meditate through it. But yeah, but it's the medications is for symptom control. And I know that there's a lot of myths about hospice, not myths, but like a lot of people are very apprehensive. And hospice gets a bad rap from people because they think that, once they go on hospice, you're going to start them on morphine and then they're dead in like 3 days. And that's not the case, with hospice. It just means that you have enough comorbidities or enough illnesses on there to make you qualify for hospice, but you don't have to be on morphine. You don't have to be on those meds. Case in point, my first story, she was not on any meds.
And she was probably in pain, but she chose peace over pain.
She chose peace over pain. Yep.
So there's got to be all sorts of stories of people that you meet who aren't comatose. They're going through the process. It takes weeks, if not months. You told me of recently you had a patient who was like 100 years old.
Yeah.
And he's all messed up and he's just like wants to die.
Yeah, he wants to die. He's like, why am I still here? Like he's like this grumpy man. He's like, why am I still here? I'm like, I don't know why you're still here. Everybody's gone, that he was close with.
Right.
And so it's like
even his doctors are dead, probably.
Right. And he has a brand new doctor who's like probably old enough to be, like young enough to be his grandchild or something,
Yeah.
But he's he only has a few family members left, and it's kind of, he gets, I know it's because he's lonely, and I know that's what it is. And we're like the highlights of his day coming in there to visit him.
Sure.
Yeah. But he struggles with living on the earth. When I go there to visit him, he's always like, why am I not dead yet? Why I want to die. And it's not even like he's
not joking either.
No, he's not joking, but he's depressed about not dying. You know what I mean? But it's not like he and I don't want people to take it as, he has some suicidal thoughts and no, he's just ready to go. Like his heart's been beating on this earth for over 100 years. Like, and all he does is basically sleep, and he's just like, and he says that all I do is sleep. And all I do is sleep. I said, well, you have it.
Is he capable of walking around and stuff?
No, not on his own. Not on his own. He has to be transferred all the time. Transferred, his body's old. He's not a young 100-year-old man. He's a pretty old 100-year-old man. So, I mean, he's, he has issues with, but there was one thing that he said to me. He says that he wants to he calls dying getting on with life.
Right. Nice.
I just want to get on with my life. And when he used to say that to me, I was like, you're 100 years old. What do you need to get on? He goes, I'm talking about dying. I want to die. He says, I'm tired of being stuck in this chair. I want to walk again. So in his mind, because he's on this earth right now, he's not walking, but he feels like when he dies, he's going to be able to walk. And he won't have to depend on anyone.
I think it's a lesson of impermanence, because like you said, he all the people that he had years and years with are gone.
Mm-hmm.
And that just shows you how, dare I use the word, futile everything is. It's like, and I say this all the time, like I use Alexander the Great as an example. I mean, the guy accomplished more than probably any human being who ever walked Earth. And his empires are gone. You know what I mean? Like,
Right.
You're not, like, they're gone.
Yeah.
All that work to conquer almost the whole world.
Yep.
Gone.
It's gone.
And then many years later, Rome came and Rome ruled, and it's gone. And now it's the United States. And you have to assume at some point it'll be gone.
It'll be gone.
And so these are empires that last centuries, and we're just humans that last 100 years if we're lucky. And it's like everything passes us by.
Yeah.
And we're, it's like, who's going to remember you? Your kids are going to remember you. Your friends are going to remember you. But in a second, they're going to be gone too.
Right. And then anyone after them they may have some memory of you, but they're not.
No.
And then after that, no one will ever remember who you are.
No, my last grandparent died when I was 17. I don't have clear memories of my grandparents.
Wow. Yeah.
And definitely not their parents.
Yeah.
And so everything fades away, and it's like we're creating sandcastles. And the wind and the sea is going to come and wipe that out. It's pretty cool.
Yeah.
So what's another story?
She was in her 90s, and she couldn't understand how she went all those years and then hit age 90 and end up with cancer. Doctors wanted her to do treatment for it and all that stuff. And she was like, no. She says, I'm 90 years old. She says, and I'm looking for quality of life, not quantity.
Right.
Because she would rather live out her days, feeling pretty okay, rather than her going through treatments and feeling sick all the time just to get those few extra years. But those few extra years, she's going to be sick. And she felt like the treatments would have killed her anyway. She was like, I'm 90 some odd years old. Of course, the treatments are going to kill me.
So what happened?
She opted for quality, not quantity.
Did she get real sick?
She did. And her only thing that she wanted to do was that summer, she wanted to go to the beach and eat lobster and drink a margarita.
Okay.
And we made that happen.
Okay.
And she thought that was the best thing ever that happened to her that year. Eating, all she wanted to do was eat a lobster on the beach with a margarita.
Okay.
So we took a field trip.
How long did it take for her to die after that beach?
Not long. She was gone in a week. And now let me tell you, she was walking when we got her to the beach. She was walking. And then The next day, she couldn't get out of bed.
Wow. And so how was her transition?
Her transition was okay. It wasn't bad. She pretty much was stated her family opted to give her meds, and so she stayed pretty much in control, but they didn't have to, she didn't have to get medicated every hour though. Every few hours that they medicated her, that they thought that she was in pain, or they thought that her respirations were getting, a little elevated. So they would, but they barely used the bottle
Of oxygen.
of morphine.
Morphine, gotcha.
Yeah.
Okay.
She didn't actually go on oxygen. She didn't need it.
When you say the oxygen levels get elevated.
No. So it'd be like, not the oxygen levels, it'd be like the other vital signs that gets elevated, like blood pressure, respirations. It's the respirations that get elevated.
Okay.
Yeah.
And
respirations is the number of breaths you take per minute.
Right.
And
the finger monitor, right?
Yeah, the pulse ox.
Yeah.
So pulse oximeter. You can have rapid, deep breaths.
Like a hyperventilation.
Yeah.
And that's an automatic body response.
That's the automatic body response. That's what your brain is telling your body that you have to do in order for you to survive. Because it's now starting to starve for oxygen.
And you can do something to medicate
alleviate the elevated respirations. Yeah.
And that just makes them more comfortable.
Yep. So we think. I could say it makes their respirations go down, suppressed.
When
which is what we look for.
When they're transitioning, like, I mean, that moment, does the breath do something?
No, not all the time. Like, so when they're transitioning, when we say someone is transitioning, that means that person becomes unresponsive. They're no longer eating, no longer talking. The active dying phases is all the symptoms that we see in an actively dying person, like the respirations sometimes are elevated, they're shallow. If they're comfortable, they can be slow and shallow. So it goes from transition to actively dying. There's a difference. Some people use it interchangeably, but I don't.
Okay.
Transitioning to me is the body is preparing itself for the actively dying phase. So the body has to rest first, because it takes a lot of energy to it takes a lot of energy to actively die, which is why the respirations get elevated. Sometimes the heart rate is elevated. Sometimes they're sweating.
So how do you go on with your regular life when you have to deal with this all the time? Yeah. Someone dies, you come home, watch Netflix. I mean,
it's kind of like that. It's kind of like that. Like, I every day when I see all my patients, I'm watching them die slowly. I see the changes. I see the decline. I have to tell them, but sometimes they know it. They can feel it. They can see it. The family members can see it sometimes. The patients themselves can feel it. They can see it too. But I watch them, and then I come home and I have my kids. Sometimes I just watch my shows or clean up my house. I have a regular life outside of hospice. I still have to live on this earth until I'm no longer needed here.
Right.
So I still have to take care of my responsibilities here.
Absolutely.
So,
well, I hope that listeners are motivated to take up meditation if they haven't yet.
It's something that definitely I think everyone should do it. I'm guilty of not consistently doing it. I honestly wish that I started earlier in my life doing it, like at least in my 30s and my 20s, somewhere maybe mid 30s. I wish that I could have started it then.
Right.
Now I'm like creeping up to the big 50. So I'm like, I'm like, so now it's like, then I have an 11-year-old that I have to chase behind. So they don't make it any easier for me to be able to sit back and meditate.
Right.
So, but I know now that I have times and spaces in between.
So, all right, Keysha, this has been a good talk.
Yeah.
Where can somebody stop in to say hello to you? Instagram, perhaps?
Yes, they can stop it on my Instagram page. My Instagram page it is open to the public. It's not closed off. So my handle is at a unicorn among horses.
I wonder where you got that from. That's in my first book, Diet and Stress Detox.
I know. I took a liking to it, so I took it, and I should have
trademarked it.
I know you should have, but it's okay. Yeah. But at least it's somebody right? That has the name and
absolutely.
Right. It's not some random person that never met you or never saw you.
Yeah.
Right. So so it's at a unicorn among horses.
All right, Keysha, thank you.
All right, thank you.
Thanks for listening to Inner Peace with Dr. Reese. If this episode opened your heart, feel free to share on social media and tell your loved ones. Also, be sure to subscribe so you never miss an episode. Until next time, may peace be with you.